Hi. Okay. Hi. Thank you so much for offering me the chance to present our research in the area of gut microbiota and neurodevelopmental disorders in Calgary. So in Calgary, we put a special focus on a type of pediatric epilepsy, which is called infantile epileptic spasm syndrome, or also infantile spasms. So this is a type of epilepsy that happens at 3 to 8 months of age. It's a rare disease. It happens around 25 to 60 cases of every 100,000 infants. So this type of disease, if not treated very well, it can cause severe developmental outcome. Unfortunately, around 50% of the patients, they are not responsive to the medication. So in those cases, ketogenic therapy has been developed as an alternative treatment. This is a typical ketogenic plate. Basically, it contains high amount of protein, a high amount of fat, around 75% from fat and around 5% of calorie from carbohydrate. So compared to traditional medication, the ketogenic-based metabolic therapy has multiple benefits by regulating inflammation, neural mitochondrial function, and also energy production. So recent years, there are growing interest about how gut microbiome communicate with the brain. We know that the gut microbes, they can affect brain function through neurological pathways, through immune pathway, and through metabolic pathway. Another intriguing study proves that the gut microbiota, particularly Akkermansia and Pyrobacteroides, they can affect the GABA production in the hippocampus, which finally affect the occurrence of epilepsy in adult rodent model. We know that for infantile phase, the gut microbiota is different. So what's the mechanism in infantile epilepsy? Keep in mind that this is a type of rare disease. So we need a model to study it in lab. Brain damage, neuroinflammation, and neurotransmitter imbalance all contribute to the etiology. Given this consideration, we create a triple hit model by giving the animals a combination of 3 chemicals: doxorubicin, lipopolysaccharide, and PCPA. So these chemicals, a combination of them can induce epilepsy in these animals. To mimic the developmental stage in infants, we use newborn rats at 4 days of age. So this model enables us to monitor the behavior and the neural activities. We start by giving the animals a ketogenic formula. So when we count the number of spasms, we find the ketogenic formula can significantly reduce the number of seizures after 3 days treatment. At the microbial composition level, we found that the ketogenic formula can increase the microbial alpha diversity, and it can increase the abundance of Streptococcus, Lactococcus, while decrease those of Escherichia. So then we ask, are there any role of the gut microbes in this protection? Because of the invasive nature of this epilepsy surgery, so it's not possible for us to introduce germ-free facility. So we employ a combination of antibiotics aiming to change the gut microbiota. So after we give the animals a combination of 4 antibiotics for 3 days, we found that the antibiotics inclusion in either animals receiving control diet or ketogenic diet, they have a low level of seizures, which means the antibiotics can improve the epilepsy. Interestingly, when we look at the microbial composition, these antibiotics, they are not removing all bacteria. On the contrary, they further enrich specific microbes, for example, the Streptococcus, thermophilus, and the Lactococcus lactis. Then we try to understand which microbes may be the keystone members. So we define 3 rationales. The microbes, they should have response to intervention to the ketogenic diet and antibiotics. They should be brain function related. They should have important function in the microbial ecology. We start by constructing a correlation matrix. So if I can draw your attention to the bottom left corner, which turns out to be the correlation between Lactococcus lactis and the Streptococcus thermophilus. So we propose these 2 species as potential K microbes. Then we start to understand the mechanisms. In patients with infantile spasms, it's found that around 20% of the epileptic infants, they have mitochondria bioenergistic deficits. Actually, in our model, we also found similar effects. In epilepsy rats, the respiration function of mitochondria complex 1 and complex 2, they are declined after epilepsy induction. However, after introducing the ketogenic formula, we are able to rescue the mitochondria function. So taking samples from the antibiotic study, we further prove that the antibiotics plus with ketogenic formula can further increase the mitochondria respiration. At the same time, it can also increase the expression of mitochondria complex 2 protein expression. And also the metabolic substrates for mitochondria energy production, such as NAD, also increased. So these findings prove that the microbiota manipulation could restore hippocampus function and improve epilepsy. So then we ask, can we introduce microbiota-based targeted treatment? So in collaboration with Lallemande Health Solution and the funding of MITEX Accelerate, we are able to start a probiotic study. First, we calculate the ratio of Streptococcus thermophilus and the Lactococcus lactis in the animals have low number of seizures. So we define the final ratio of the 2 species as 5:1 for treatment. Based on the pediatric recommendation, we use 1 billion CFU per animal per day for treatment. So at the same time, we also introduce a control strain, Lactobacillus salivarius, to exclude the potential effects from lactate. This is as a result from probiotic study. So first, we use microbiome sequencing to confirm the colonization of the strains we give to animals. And when we look at the number of spasms, it's really exciting for us to see that the probiotics could reduce the number of seizures in animals receiving control diet or even the ketogenic diet. We also perform another locomotion behavior test, and it further validate the benefits of the probiotics. When we look at the expression of pro-inflammatory cytokines in serum, we found that probiotics can reduce the concentration of pro-inflammatory cytokines interleukin 18, 6, and TNF-alpha. In the hippocampus, the probiotics further increase the mitochondria respiration. And we also use in vitro cultures to prove that this microbial mixture, they can produce active molecules that may mediate the gut-brain interaction. So taking advantage of this animal model, we were able to test a couple of treatment and a couple of hypotheses. For example, we further study how to employ ketone ester as an alternative treatment to reduce seizures in these animals. And we also study if we switch the diet, can the benefit of the ketogenic still hold? We also test different prebiotics, their effects on the function of ketogenic diet. So you're welcome to forward to these publications in this area to dive deeper. So with above findings, we are able to prove how the gut microbiota can affect the function of ketogenic diet in the context of infantile epileptic spasms. So moving forward, we hope to translate these findings to clinics so we can help the patients in need. Finally, to give you some information, earlier this month, December 1st to 7th, that's the International Infantile Spasms Awareness Week. Because of this type of rare disease, we need more knowledge to help those infants because it's a type of severe epilepsy. So urgent treatment or diagnosis are needed for sure. Finally, I would like to thank to my supervisor, Dr. Jinshira, and our collaborators in Calgary. So I'm happy to answer any questions in the Q&A session. Yeah, thank you for your attention.